685,000 people died out of breast cancer. And also, the Center for Disease and Control Prevention have brought out a figure of 333,000 women who are going to be affected with breast cancer at the end of the year in the United States.
Is basically the abnormal growth of cells in one's breast. Okay, so if anybody has a breast, anybody who has a breast, I mean, is at risk of getting breast cancer. So it's just abnormal growth of cells. So there are a lot of challenges, as I mentioned, financial stigma, family support, and all that. So some organizations take it upon themselves to sponsor or cut down on the costs of treatment or
that breast cancer is one of the deadly diseases in the world. Statistics have proven that in 2022, the World Health Organization came out with a figure which is 685,000 people died out of breast cancer. And surprisingly, out of this figure, 0.5 to 1% of them were men. Also, the Center for Disease and Control Prevention have brought out a figure of 333,000 women who are going to be affected with breast cancer at the end of the year in the United States. With this rising in figures for breast cancer, my team and I have taken it upon ourselves that we are going to educate the public on breast cancer, the prevention, and how to manage it if some of my viewers are unfortunate to be diagnosed of having one. So, I am here today. My name is Alano Faustina, here to educate you on health talk on Amasel TV. And you know, we cannot educate you more on breast cancer without inviting someone who is more vested in the field. So with me here today is a beautiful lady. She is a nursing officer at the Whole Teaching Hospital, Trafalgar, working at the Pediatric Emergency Unit. She is by name Miss Janet Akafia. Welcome, Miss Janet, to Amasel TV.
Thank you.
How are you doing?
I'm fine.
How are you? Fine. It's been a long time.
Yeah, it's nice meeting you again.
Nice meeting you too. I like your dress with the pinkish design.
Okay, so this is basically something for breast cancer. Okay. So this month of October we are talking about breast cancer. So I just decided to put a touch of pink here to just pink it out.
Okay. Then from today I'll be wearing pink every day.
Ah, yes.
Since we are in the celebration mood. Okay.
You should.
I also heard you are an advocate for breast cancer. How is it going?
Okay, so far so good. We are still going on with our education. Anybody we meet, whether at our workplace, in town, in the market, we talk to people about breast cancer because you know early detection saves lives. So that is basically what we are doing. Education is key.
Okay. So I want to ask a question. It's like when you go on social media, Facebook, WhatsApp, Instagram, breast cancer, breast cancer, breast cancer. When you say breast cancer, what does it mean?
Okay, so basically why you are seeing all those things on social media now is because the WHO has dedicated the month of October for us to talk about breast cancer. More about breast cancer, because any other month we always talk about breast cancer, but in the month of October we want it to be out there. Okay, so breast cancer is basically the abnormal growth of cells in one's breast. Okay, so if anybody has a breast, anybody who has a breast, I mean, is at risk of getting breast cancer. So it's just abnormal growth of cells in the breast.
Okay. So is there a cause for this cell to grow abnormally?
Okay, so for breast cancer, we don't really have a cause for it. You know, if someone has malaria, you can easily say that, oh, this person has been bitten by a female Anopheles mosquito, and then that resulted into having malaria. But for breast cancer, we don't really have a cause for it, but we have risk factors. I mean, things that when you have, you are prone to getting breast cancer. Yes.
Okay, so let me ask this question. Right now you are saying there is no cause for breast cancer, but there is a saying, some rumor going around that if you put money in your braziers, if you wear tight braziers and stuff, you are prone to getting breast cancer. So I want to know if they are true or it's just a myth. That's
okay. Thank you so much. And for those things, as I said earlier, we have risk factors. Okay, so research has not really proven that if you put money in your brazier and all that, you are prone to getting it's a cause for breast cancer. Okay, but all those things can be risk factors. Okay, because there's a lot of things that goes on if you wear tight bra. There's heat, there's production of heat, a lot of reactions go on there, so it can be a risk. Okay, but people normally say that that's the cause for it, but research has not really proven that. Okay, but we have a lot of risk factors. Okay, things that when you see, you'd say that, oh, if you continue with this, you might end up with getting breast cancer at the end. But I want to group it into two. We have the modifiable and non-modifiable. So for the non-modifiable, that one, there's nothing you can do about it. The fact that you have breasts means that you are at risk of getting breast cancer. Okay, so men do have breasts. So men also are prone or have the risk of getting breast cancer. A lot of people don't know that, but men too are at risk, and then the female as well. Obviously, we have a bigger one. Okay, so for, as I said, the non-modifiable risk factors, you having a breast, you're at risk of getting breast cancer, and also you growing up or aging. Okay, so as you age, you're at risk of getting breast cancer as well. And also, there are some researchers that have said that being exposed to radiation.
okay.
Yes, so if you are being exposed to radiation, it could be having an X-ray done, or being around a company, or there's a company that produces a lot of radiation and all that. You are at risk of getting breast cancer. And also some of our actions, that is for the modifiable one, is something you can do about it. That's your lifestyle. Okay, how you manage yourself, as you said, putting money into your bra and all that, wearing tight bra, and also not washing your bra regularly. Some people wear black bra under hot sun and all that. Those are something we can actually things we can do about, like frequently washing your bra and all that, to just be free from some of the risks that we have. And also your lifestyle of like taking alcohol, and also smoking excessively, all those things put you at risk of getting breast cancer. And also lack of exercise. Exercise is one of the things I've been saying that is basically a preventive measure for most sicknesses. Okay, so exercise is really good for you and any other person out there.
Wow, exercise.
Yeah.
Then I have to start exercising every day because I'm not a fan of exercise.
You have to. Okay. Because it's really, really something that we don't really talk about, but it helps.
Okay.
Yeah.
Okay. So moving forward, I want to ask, what are some of the signs Like, what are some of the things that if I see, or it will prompt me that, this is a sign of breast cancer, let me go to the hospital and check out to see if it is true or not?
Okay, so first of all, I would say that having a feel of lump in your breast, okay, it can either be in your breast or under your armpits, okay. So if you have a feel or you feel that you have a lump in your breast, you should ask a healthcare professional to also examine your breast and then check it out. If he or she is not sure, would ask you to do a scan. That's ultrasound. Okay, so if you are more than 40 years, he would ask you to do a mammogram. There are all ways of detecting if there's lump in the breast. Okay, so, and also if you check your breasts, the normal breasts for females, one actually looks slightly bigger than the other.
Sure.
Most people also have their breasts on the same sizes. Okay, but if you know your normal breast and you realize that no, this time round, this breast is becoming bigger than this, then I think you have to seek for health care.
Okay.
And also if you see a change in color, okay, the color of your breasts has started changing, you also have to seek for, and most of the times too, there are discharges, okay, if not the normal milky discharge, like if you are breastfeeding, I mean, but if it's bloody, you should seek for health care.
Oh, okay. Wow. So moving forward, we can talk about breast cancer without asking about women who are already having breast cancer. So what are some of the challenges or the stigmatization that the women who are already having breast cancer facing?
Okay, so for the challenges, there are a lot, but I would like to touch on one or two, especially as the financial constraints it brings to these women. Is very, very costly. Having breast cancer, it means that most people, I mean, those are myths. Maybe we'll go to it later. But most people think that it's a death sentence because they don't really have money to treat it. Because treating breast cancer is very expensive. And then the health insurance or other insurances doesn't cover it. So you basically have to do everything from your pocket. So most of them, when they start the treatment like this and they don't really have money or family support and all that, they tend to draw back and then seek for herbal, exactly. They rather go for herbal treatments, okay, because of the financial constraints. And most of the one other challenges that a female having breast cancer tend to lose her partner. Okay, the man ends up leaving her because he thinks that, oh, this, you know how the breast is to men, okay, and the breast is now not in good shape and all that, so they tend to leave the woman. And also family support. Some of them, people think that breast cancer is contagious. So if my auntie gets breast cancer and I'm always there cleaning my auntie and all that, I also get breast cancer. So they tend to withdraw from these women and they go through a lot, okay. And the stigma, as you said, that's what people feel like. If someone has breast cancer and then it's because they've offended a god or something, so they tend to withdraw from them. They don't really give them the love and support that they need. So there are lots of challenges, as I mentioned, financial stigma, family support, and all that. They are all challenges.
When we were talking about the challenges, I realized that you were handling in the financial aspect. So I want to ask if there are some resources that are available to support people with breast cancer.
Unfortunately, not one that is out there, okay, talking about the government supporting people with breast cancer. There's none like that. But we have organizations, okay, and philanthropists, people who want to just assist people, women especially with breast cancer. So some organizations take it upon themselves to sponsor or cut down on the costs of treatment or the diagnostics, I mean. So some companies, like I know of MedStar Health Consults, in the month of October, they do a discount. We have a discount on ultrasound for women. And also Sonotech has a discount on mammogram as well. So those are the things they do to help individuals and philanthropists who want to help in the treatment, because the treatment is a lot, it involves a lot of money. So there are people out there like that, but government or it's not out there that if you get breast cancer automatically there's finance or there's money for you to get treated. It all comes from the family and the individual's pockets.
Okay, so I want to ask if there are treatments, like what treatments do women or people who are diagnosed of having breast cancer take?
Okay, so it all depends on the stages, okay, of the breast cancer. So we have the stage 1, stage 2, stage 3. So stage 1, basically the breast cancer, the cancer is localized, I mean. So for that, we can do a biopsy or surgery can be done to take out the lump, cancerous lump in there. And then you undergo chemotherapy and then you are fine. And then subsequently you go for checkups and you're okay. And also some has to involve the total removal of the breasts. Yes, so it involves a lot, surgery, chemo, and then some medications as well.
Okay. So with all what you are saying, I want to know what are some of the myths, because from your delivery, I just realized that men also get breast cancer, but it's more or less like women. If you say breast cancer, everything is geared towards the women. So I want to know what are some of the myths.
Okay, so one myth is what you just mentioned. People say that breast cancer only happens in women. It's a myth because it happens in men as well. As I said earlier on, if you have a breast, you're at risk, or you might end up having breast cancer, I mean. Yes, so it's a myth that it's only women that have breast cancer. The other myth is also that people think that those with bigger those who are endowed have tend to have breast cancer than the smaller breast, but it's also a myth. Someone with a smaller breast is having equal chance of getting breast cancer as someone who is endowed. And also one other myth is that people think that breast cancer is spiritual. Okay, so because it doesn't really have a cause. So okay, if there's no cause for it, then it means it's my grandmother somewhere that is doing me or something. So it's also a myth. It's not spiritual, I mean. Science doesn't prove that it's spiritual. We have risk factors. Even though we don't have causes, we have risk factors. And also, there's a myth that if you have breast cancer, it's a death sentence. No, people get treated and they become normal people again. I know a woman who was diagnosed with breast cancer 20 years ago, and that person is still alive. Okay, so as I said, early detection saves life. If we get to see it very early, treatment is done and you are fine, you are moving about your normal duties. So it's not a death sentence if you have breast cancer. You just have to detect it early.
Okay. So, Miss Jenny, final words.
Okay, so thank you so much for having me. Okay. But all I want to say is that breast cancer is killing a lot of women, especially in Ghana, because we are not diagnosing it early enough for treatment to be done. So in this month of October, I urge everyone, being a male, female, go to any health center around you and have yourself screened, have yourself checked. Okay, breast cancer is real and it's really killing a lot of people. We want to detect it very early and have the treatment done. Okay, thank you.
Okay, thank you very much, Ms. Janet.
Thank you too.
Dear viewers, thank you for joining us on today's episode of Health Talk on Amasel TV. Don't forget to subscribe, comment, and share to your friends. I hope you were educated very well. But before we go, we want to teach you on how to do the self-breast examination so that every month you'll be able to examine yourself on your own. Thank you.
Alright, so for the breast examination, self-breast examination, mostly I'd advise the women to do it after their menses because the breast becomes lumpy before your menses. Okay, it's good to have it done yourself, but once in a while you should visit the health care center to have a professional do it on you. So all you have to do is to stand in front of a mirror and then examine your breast. I mean, watch it carefully. If there's any change in it, you get to know, and you have to know your normal breast as well, okay, before you can notice any change. So what you have to do is to put, if you are examining this breast, you put your hand, your left hand at the back of your head, facing the mirror, then with your padded palm like this. You start from the armpits, you press in a circular motion to be sure that you are not touching any lump. You know, the normal breast has a lump in it, but if you feel any abnormalities, you definitely know because it's different from the normal breast lump that we all have. So you go in a circular motion, start with in your armpits, then you come to this side in a circular motion, up, come, up, go in a circular motion, looking out for any lump until you get to the nipple side. Then you squeeze the nipple to see if there will be any discharge. So after you drop this hand, bring this hand back this way, then you start from your armpits, go in a circular motion this way, come this way, go like this with your fingers like this, all together like this, looking out for any lump in it. Get to the nipple side, you squeeze for any discharge. Okay, so you can do this while standing or lying down in bed. Okay, then for the mirror is really necessary because you are looking out for any changes in the breast because you can't really see your breast this way, but looking into the mirror is the best. Thank you.
Hello everyone, welcome to Amasel TV. I am Janetta Kafia, a nursing officer at Whole Teaching Hospital. Today, I would want us to talk about a very pressing issue here in Ghana and worldwide. That is preterm. Before we continue, I would like you to subscribe, share, like, and comment. Thank you. So preterm Preterm babies are babies born before their 37th week of pregnancy. I said earlier on that preterm is a very pressing issue. Yes, because according to WHO, it is the leading cause of death in children under 5 years. An estimated amount of 15 million babies are born preterm. Thankfully, WHO has set aside 17th of November as World Prematurity Day. Hooray! This day is a day where we all health workers and stakeholders come together to talk about prematurity, the causes, the risk factors, and then the prevention methods. I'll go straight to the risk factors of giving birth or reasons for giving birth to a preterm baby. I'd also like to break it down into two, that is the maternal side and then the fetal side. So for fetal, God in his own wisdom or in his own knowledge brings out babies that are not formed well in the uterus. That is, maybe they have a congenital heart disease or any other diseases that would affect them when they grow up. So these babies come out naturally even before their time. For the maternal side, we have one major cause, should I say, an unknown cause. Yes, people don't know why, or researchers don't know why mothers give birth to preterms. Secondly, mothers of the age of 35 years and above have a higher risk of giving birth to preterm babies. Mothers who have diabetes, hypertension are at higher risk of giving birth to preterm babies. I would also like to talk about maternal reasons why people give birth to preterm babies. Mothers that are of younger age who get pregnant have the higher risk of giving birth to preterm babies. That is, teenage mothers. Also, women who give birth frequently without breaks. If I say that, I mean that if you give birth this year, you need to have a break of 1 to 3 years before you get pregnant again. But if you do that every year, you are at a higher risk of giving birth to preterm babies. Mothers who also have a previous history of giving birth to preterm also have the risk of giving birth to preterms as well. Multiple pregnancies like triplets, twin gestation, quadruple are all at higher risks of giving birth to preterm babies. As I said earlier on, some of these reasons are unknown. Some can be prevented. Some, nothing can be done about it. To talk of mothers who drink or smoke, if I say drink, excessive alcohol intake during pregnancy also have the risk of giving birth to preterm babies. These reasons or these risks can be avoided. That is why we are here to talk about this to mothers or incoming mothers to prevent giving birth to preterm babies. Preterms go through a lot when they come out. Babies are supposed to spend 9 months in utero, 9 months and above in utero, before coming out as matured babies. But these preterms are not matured enough. Talking about their organs are not really matured. So they go through a lot of problems. These babies come out and they are tiny, very small to handle. That is, they have low birth weight as compared to normal babies. their organs are not fully developed, so they are prone to other diseases and infections as well. I would first of all talk about the short-term problems of preterms. That is, they have immature brains. Yes, these preterms have all that. They also have immature organs. That is the kidney, the liver, the lungs. So they end up having difficulty in breathing. They have breathing problems as well. Their way of regulating their temperature is also not at its best as the normal baby can. These babies are very tiny, as I earlier on said. So we as health workers and stakeholders involved, we have to come on board and help these babies thrive and live on. Someone would ask, would this baby ever live? Yes, there are lots of babies born preterm that are now adults and doing more for Ghana and worldwide. So that will then treat all of us to come on board and get this done. One thing I would like to say is how we're going to handle these babies when they come out. As I said earlier on, their organs are not fully matured. So they tend to have a lot of problems, talking about their sugar regulation, their temperature regulation, and so on. We need to frequently feed these babies to be able to get exactly what they need for their body to be used. We also always have to take care of them. That is, wash our hands with soap and water under running water before we even touch them, because we term them as very fragile. I would also want us to talk about how we can also handle the mothers as stakeholders. These mothers sometimes feel stigmatized or are stigmatized about the fact that they gave birth to babies that are not ready to be born. So we have to embrace them as well. Embrace those mothers, teach them how to handle these babies, and also educate them that these babies can actually live. What they are going through is just temporal. We all have to come on board and have them thrive and live on. These preterm babies have long-term problems as well. I earlier on said that they are not matured well enough. So they end up having conditions like cerebral palsy, hearing problems, vision problems, and so on and so forth. That is why I ask that if these babies come too early or too soon, we still have to all come on board and embrace them so that they can develop just as they are in utero. That brings us to the topic, or to this word, kangaroo mother care. So kangaroo care is a method of carrying the baby skin to skin. This method was previously called kangaroo mother care, which means only mothers can do it. But now we are saying that everyone, both father and mother, can have it done, because sometimes these babies come out and their mother is not there. So any member of the family can provide this warmth or this care to their baby. It has a lot of benefits. That is, the bond it even creates between the person carrying the baby and this preterm baby as well. I earlier on also said that these babies have problems with breathing. So whilst you carry this baby on your chest, you would notify or notice that whether the child is breathing normally or abnormally. It also helps to regulate the temperature of the baby. This brings us to the theme of this year, Prematurity Month. This year's theme is a parent's embrace, a powerful therapy, enables skin-to-skin contact from birth. Yes, we always have to embrace these preterm babies if we want them to live. Because I always say that this time of their life is a do or die affair. They might live or not. If they live, it will depend on you and I. That is why I want us all to come together and support all mothers who give birth to these preterm babies. Thank you. Don't forget to subscribe to the channel for more updates on health issues here on Amasel TV. Like, share to all your friends and family as well. If you have any comments or questions, kindly drop it in the comment section below. We are ever ready to give you your reply anytime soon. Thank you.
Oh, okay. You've spoken a lot. And then big words like kineteros and all that. Some of us don't understand. So when we see jaundice, what should we see in a newborn?
Yes. So jaundice is basically when you look at your newborn and realize that the skin or the eyes is yellow. That is just jaundice. And yeah, so that's jaundice. And kernicterus is basically when we don't detect it early, and then now the jaundice goes into the brain, and so then it kills the brain cells, and so now the baby goes up and then it becomes disabled. So you realize you have kids who have CP or cerebral palsy. So you have kids that are growing up, and then they have these disabilities. They can't walk, they can't talk very well, they can't school, and these are all results sometimes from jaundice.
Wow, then jaundice is very dangerous. Oh wow, wow, wow. So the jaundice can actually have effects on newborns, babies, child, and even if you grow up and we don't treat it well, it can actually kill. Oh wow. Final words for our viewers and also for the public.
Yes. So our final words is spot the yellow, stop disability and death. Thank you very much.
Wow, thank you so much, Dr. Alote. Hello everyone, welcome back to Amasel TV. We are still here in Home Market educating people on newborn jaundice. We have other medical students among us. Hello, please, what's your name?
Please, I'm Watson Jeff Tausu.
Come again.
Watson Jeff Tausu.
Watson, please, who are you and what are you doing here in white?
Please, I'm a fifth medical student and we are here to campaign against jaundice.
Wow.
You can see here, early detection of newborn jaundice saves lives, you understand?
Wow.
Prevents disabilities and death before 5 years in children. That's why we are here.
Okay, thank you so much. I can see you are really doing well. Let's move on to the next person. Hello, in charge. Hi. Okay, in charge. How are you doing? We are from Amasel TV and we want to know your view on jaundice and why you are in yellow.
Okay, I'm in yellow because today we are trying to tell the public about jaundice. We are saying that everyone should be a jaundice police. A newborn baby, you see that the skin is yellow, the eyes are white. You don't put breast milk or anything there. You just bring the baby to the hospital so that we'll take good care of the baby. You have to bring the baby fast, otherwise it will generate or it will cause many disability or many things that we can't do it later. Yeah.
Okay, thank you so much. Final words to the public and Amasel TV.
We want to tell them that we are there for them. As we are in whole teaching hospital, we are there. Come to the hospital, come to the children's ward, come to the OPD, and we'll take care of you. Don't be at home. Come. All the children are our future leaders. Come and we'll take care of you. Thank you.
Thank you so much, in charge. The children are future leaders, so we have to and always have to bring them to the hospital if we spot any yellow on their eyes and their body. Thank you so much. Catch you later. Hello everyone, welcome back again. We spot some few doctors among us and want us to have a chat with them. Hello.
Hello.
Good morning, how are you?
I'm fine, thank you.
I can see you in yellow. Is there any reason for that?
Yes. Thank you, the Ghana people, for the opportunity I participate in the work for the jaundice.
Okay, so she says she's participating in jaundice. So can we ask you, what is jaundice? What do you have to say to the public about jaundice?
Jaundice is the yellow color in the skin and it's most important for the mother know about the normal color in the newborn and know when the newborn is have a yellow color in the skin and go to the hospital or to any polyclinic for the care.
Okay, thank you so much. We have really learned a lot. So she's basically saying that we should report early when we see our newborns with yellow skin and yellow eyes. Thank you. We are grateful for having you.
Thank you.
Welcome back to Amasel TV. Right here we are at Whole Teaching Hospital. We want to talk to one of our organizers, the person who organized this jaundice program. Hello, sister.
Hi.
You're welcome.
Thank you.
Okay, so I want you to tell us a little bit of how the whole preparation went for this jaundice week.
Okay, it went well. We started last week Friday. The program was launched last week Friday and we'll climb us up, God willing, tomorrow by going to churches. Yes, so far so good.
Okay, so I want to ask the last question. What's your aim for the week? Have you achieved it?
Oh yes, we've really achieved our aim. The aim is to stop disability and death in children in neonates. That's from 0 to 28 days. So we've really achieved our aim. Yes.
Okay, thank you so much. Any last word for our viewers and also people around and the public to know about jaundice and take quick action for it?
Oh yes. Ta mi afe nukola o mi be join this zigede na medo no jivi evana devi o me devi ke oji chuegbe vada sine mi chobe jindeka akpobe devi even ku wa yellow efe wi wa yellow ta mi le education ke wa place ba mesia me na nye join this police nem devi menye we jikra na ekpo ba me de jivi le ife area me ko ya devi efe nku ji na igbo ko wa yellow me ku na chi na ebe ne ko ide koji and mile chichina jila uchebe no jujo and no tifiafia de viope nkuji thinking be ya stop the viope nkuhe wa yellow I'll must stop you the best thing nyebe wa cover koji. Yes.
Oh, akpekakaka nye ha mesronu gede obe mi akọ de viova koji ne mi akpo ogbo mi jijo no chifafia de nkuji now akpe na okakaka weva odo
Akpe na mi ache.
Thank you so much. We just spoke to one of the organizers for this week's jaundice program. We'll call on other organizers as well to talk to us on how the whole process went. Thank you. Hello. I have with me here the nurse manager for Pediatrics at BMC, Matron Matron Mary. I want to mention the full name. Matron Mary. Okay, you are welcome.
Thank you.
All right. So I understand you've been part of the organizers for this program. How did it go?
Thank you very much. In fact, it was very tiring and involving a lot. From day one, how to do the planning, how to get things on board, and how to even organize the people for the program. It was very tiresome, but God being so good, we are at the end of the program. We are so grateful.
Okay, thank you so much. And I believe that your aim for this has been achieved.
Well, I would say it has been achieved to some extent because we want this education to go to the public, down to the earth, to the villages and the communities, because we don't want it to remain in the city, because we think they face most of these challenges because they are deprived of most of the big hospitals. So we want this education to go far to that level, the cheap compounds, the health centers, so that as early as possible they recognize this change in color in the baby, they can quickly seek health care for early treatment. Thank you.
Thank you so much. We're just speaking to our matron nurse in charge of the pediatric sub BMC. Please, any last word for our viewers?
Yes, please. Thank you very much. What I want to say to the viewers is that neonatal jaundice kills. So we have to act quickly. We have to act fast. Anytime you notice any discoloration in the eye, in the face, the color of the skin of the baby, you quickly get to the health facility and seek for help. Don't stay in the house and use any other thing in terms of the breast milk, in terms of glucose water, in terms of some say you put the baby under the sun. No, all those things are not doing anything neonatal jaundice treatment. It's better to come to the hospital as early as possible because it causes so many disabilities in the baby. It can cause deafness, it can cause disability, the child will not be able to walk again. And so we are entreating everyone, the public, everyone, even if it's not your child, as soon as you recognize this color change, you let them seek for help. Thank you.
Thank you so much. Bring your child to the hospital as soon as possible so that we can detect and treat. Thank you so much, Matron. The committee responsible for this organization. And here with me, I have the chairman for the committee, Dr. Selom Trakasu, sorry. Welcome, Doctor.
Thank you. Thank you for having me.
Please, how are you doing?
I'm doing very well, excellent. In fact, I'm energized.
We bless God. Okay, so I understand with planning of this programs like this, there's a lot of challenges and all that. Can you share one with us?
Oh, in fact, I'll say the overall outcome of this month's celebration has been very good and successful. Initially, the challenge was with organizing people to rally around and sensitizing them towards the program. But as time went on, the fever caught everyone. And so I'll say it's been totally successful.
We bless God. So, can you say that your aim for this program has been achieved?
Oh, yes. Our aim was to get to the public, communicate with our people in the community, and create that awareness about neonatal jaundice. And we got all of our staff from the SAP BMC, that's the Child Health Department of Whole Teaching Hospital, and even the students from the University of Health and Allied Sciences have joined us for this great health work where we went out, shared flyers, and spoke with so many people. And so I believe our target and goal for this program has been achieved.
Okay. So, do you have any advice for the public on jaundice, neonatal jaundice?
Yes, I'll continue to encourage our mothers, especially who deliver, that once they deliver, they should be very observant, look out for that yellow discoloration of their baby's eye or skin, so that if they notice it, the first thing is to report to the hospital, because neonatal jaundice is curable, and so they should not hesitate when they see it.
Thank you so much, Dr. Selom Trakasu. We've been speaking to the chairman of the committee. Thank you.
Thank you too for having me.
All right, welcome back. We want to speak to the HOD for Pediatric Sub BMC. It's in the person of Dr. Daniel. Hello, Dr. Daniel. Yeah, welcome.
Thank you.
Please, how are you doing?
I'm fine, thank you. Exciting day, eh?
Yes, I can see. You are really exhausted. So I want to just engage you a little bit about the neonatal jaundice week. Was your expectation met?
So, once again, good morning. It's a very calm morning here this Saturday, and we're just returning from our walk to the principal streets of Ho. The operation was to share 1,000 flyers to all people that will meet during the walk. And we even made it a step better by getting stickers. The idea is that when people, after reading, can stick this to their fridge where they are selling their wares, those on the street can even paste it over the electric pole and then other notice boards, so that it could be a reminder to people about the devastating effect of newborn jaundice. So yes, the expectation was met, the attendance was good, and we thank the planners and organizers for today.
Okay, thank you, HOD. What are your expectations in the following year for this jaundice week celebration?
We've asked for some few things. We are still hoping and praying. We've asked some support from the Office of the First Lady, for example, for some equipment that we need in treating newborn jaundice. It is our hope that we are going to get all this equipment to help us take care of these children with jaundice. So once we've started making noise about jaundice, it means that now people know and people are going to bring their children. The problem now is that the equipment that we are having may not be able to cater for the numbers that may come following this advocacy. So yes, we are expecting that the public and those who have and those who can donate can get us this equipment to take care of the numbers or the pressures. This child should go and then come back quickly for another review. It will be important that we get one of these at least, so that we can better care for these children. Another equipment will be the phototherapy machine. Usually we say that for jaundice treatment is with the blue lights, and these blue lights, we have those equipment, but once the numbers increase, it may be difficult to catch up with those. So if we get more of these photo machines, we'll be so happy and delighted. And then of course, a higher form of the
Okay, viewers, as I said earlier, today we have a noble gentleman from the Pantine Psychiatric Hospital here with us in the studios of Amasel TV. He's here to enlighten us more. As we said earlier on, depression has been one of the leading cause of death by the youth. Today you hear someone just died, someone just killed himself or herself out of an unknown cause. So due to that, you brought someone here or someone who is well into that field to educate us more on the word or on the topic depression. All right, welcome, Mr. Richard.
Yes, my name is Richmond Bafo.
All right.
Yes.
This is Amasel TV. Welcome once again.
Thank you very much, brother.
So can you tell our viewers who you are? Like, they want to know you more.
Okay. My name, as you said, Richmond Bafo. I work at Pantine Psychiatric Hospital, precisely Community Mental Unit. I've worked no less than 10 years at Pantine.
Wow, that's so magical. We are humbled, sir. All right. So as you've all heard, he is Mr. Richmond Bafo or Bafo.
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 Yes.
Sorry for the mistake. Yeah. So let's kick starting because time is running out. Let's kick starting.
Okay.
All right. So Mr. Richmond, when you talk about depression, we want to know what depression is, the meaning of depression.
Yeah. So my brother, mental illnesses are being grouped under different subgroups, and when you talk of depression, it's fall under one group of the category, as I said, under mood disorder. So depression is one of the mood disorders which causes people to have persistent feeling of sadness and also let them have loss of interest and affect their daily function. And such a person must not experience this in less than 2 years. So when the person's experiencing these kind of symptoms and so forth and is not below 2 weeks, then the prescriber or whoever may, a specialist who may attend to the person or classify the person to have depression.
So meaning depression is not yet depression until it's past 2 weeks.
Yes. People or anybody can experience one or two of the depressive symptoms, depending the daily stressful events and so forth. But you don't term it as a disorder. Yes. So it becomes disorder when the symptoms, those usual symptoms as the person is facing persist for more than 2 weeks. And it shouldn't be less than 2 or just 2 or 3 symptoms. Then you say the person has the disorder, not at all.
So what are the symptoms? What are the symptoms?
Yeah. Depression, as you say, from the definition the simple definition that I gave for every lay person to understand, when you say is a mood controls our happiness and our sadness. So this side, the person is very sad. And when it happens like that, it depends the level of the depression. So the mild form of the depression, the person will start having this sadness mood. The person will draw from people. The person will have loss of appetite. Most of the times, too, others also do gain appetite. So either the person eats too much or the person doesn't eat at all, and all results into either the one eating too much will gain weight, the one not eating will lose weight. Some also will sleep a lot, some also will not sleep at all. In our term, as you say, insomnia, those that they have difficulty in sleeping, those that they sleep too much, we have the hypersomnia and so forth. So the symptoms are a lot. The person will neglect personal hygiene, most of the times, not bath, not groom well. If it is a woman, not kept the hair and so forth. So all these are symptoms of depression. Yes.
Wow. So before we move to the next thing, I would like to let our viewers know that this edition on Amasel TV is brought to you by Brainworld Academy. Brainworld Academy is located in Masanankese, where you can register for your WASI remedials DEC, and etc. And also we have Excel Mall and delivery services also in Ho. When you are in Ho or around Ho and you want to get something like sneakers, shirts, what have you, or maybe you want to deliver something to someone, there'll be a link, or sorry, there'll be a number in the description box. Kindly contact them, Excel Mall, and you get sorted out. All right, Mr. Richmond, let's continue. As you were saying, some people eat too much and some people does not eat too much. So focusing about the food. In terms of depression, okay, aside a person eating too much or not eating less, does it have effect on the person nutritional status or something? Because maybe I was thinking because it's a disorder, even if you eat crab, because you are not in your right state, you will not see the effect of the food or something. Is there anything like that?
Yes, there's nutritional issue when the person is not eating at all or the person is eating less.
Okay.
We all understand that food, as we know, is really part of our health maintenance.
Right.
So if the person is not eating as the body is demanding or as the body wants, one, carbohydrate is a question here. So the person won't have enough carbohydrate that will give the entire body energy for the person to perform well. So you see that the person will have what is called lethargy or being weak and so forth, and the person will be less productive. Yes. Other nutrients that the food must provide, depending the ingredients being used to prepare the meal, is also a factor. So if the person is not eating much and the food constituent, is also not enough, like the person will have vitamins, minerals, proteins, fat and oil, and even water taking becomes a problem because the person is not eating. How much more of taking water? So if the person is not really eating, all these things become a factor, as you said, nutritional wise, and you see that the person starts depreciating. Yes. And if the person is eating too much too, the carbohydrate, you see, in my definition, I said it makes the person loses pleasurable functioning. So the person will eat perhaps 2 balls of kenke, 2 balls of banku, and the person is not doing anything. The person is just sitting down. What will happen? All will tend to be fat and so forth. And you could see that the person is building up bloating and bloating. At the end, obesity will set in, or even the sugar, the blood sugar will be abundant, and it will be overweighing the insulin you're supposed to convert this glucose and then hide it for the body to use it later on. So all this becomes an issue. Yes.
That's so fantastic. And there was this confusion I had some time ago.
Mm-hmm.
You see, I don't know whether it was depression or not depression, but I realized I was just being isolated. Like I was just isolating myself for everything.
Okay.
But I eat normal. Yeah. I can go outside, mingle with people, but it's like I fake this. I don't know. Can you classify that one too? Or is like you'll be around like this and I'll be faking to be happy or something just to hide what I'm feeling inside.
I'm getting you. We do have daily stressful events that makes people have some kind of mood swings, which we do not define it as a depression disorder. Now, it becomes a disorder when those symptoms the person is going through persist for more than 2 weeks. That's one criteria. 2, when it influences the person's daily function. So the person uses to go to work all the time, every day. Now the person is not going to work. The person interacts well with people, associate well with neighbors and so forth. Now the person is indoor all the time. So all these things will give the clue. And all these things have persisted for more than 2 weeks. So it's giving a clue that this is not the usual daily stressful event attitude, right? Good. So that's the difference.
Okay. So is there any causes?
Yes. When you say causes, to the layman, they will say causes. But scientifically, no school of thought has come out straightforward that when you talk of depression, you have a cause. So what all the other disciplines, other school of thoughts are saying are contributory factors? The factors which contribute to depression. So the direct cause, no, but you have factors that contribute to somebody having depression. Yes. So if you say, so now it's not the cause, but rather factors which contribute to depression. So you have the factors, normally you group them into 2 categories from our own end.
Okay.
Yes. So I would say you have the biological factors, then you have the environmental Yeah. So with the biological factors, they are the factors within the person that makes the person predisposed to the depression or makes the person being susceptible to depression. Yes, meaning that the factors are there, but something needs to trigger for the person to have depression. So the biological factors, one is hereditary. Depression, as you know, runs through family, through the genes. So if the father, the mother, the siblings, any of them experiences depression, there's likelihood you too, you may experience depression. Yes. You also have illnesses. Illnesses, as you say, you have malaria, you have meningitis, you have typhoid. All these things push people to be depressed. Example, HIV, other chronic illnesses, diabetes, hypertension. Some people, they don't take it so light. When they hear the news, they have cancer and so forth. In fact, they don't take it light. And due to that, it pushes them to experience depression. You also have what is called brain chemistry imbalance. As you know, the brain is not just there, as you say it, white when you kill animals. There are other chemical gaseous substances within the brain that actually foster its function. And when these neurotransmitters are not balanced, it can also lead people toward depression. So the biological factors, these are what I want to mention under the biological factors. When we come to the environmental factors, you have what is called the stresses you have in life or stress life events. So our daily functions, you get to know that you meet things which are much difficult for us to handle. Life events like losses. When you say loss, it comes in so many forms. You can lose your loved one, and that can push you into depression when you are much susceptible. You can't lose your money through betting and certain things perhaps you may not be able to mention. And as this one is public, I can. Men's Good, for instance. A lot of people lost their money, and at the end, they were much depressed and so forth. So you can even lose your body part, like through amputations and so forth. Or any forms of loss can push you into depression, right? Yeah, you have under the stressful life event, you have unemployment. Now it's a public concern, one of the most public concerns. So the youth are not getting job. They've completed tertiary school for more than 7 years, 6 years, 5 years, not having job, not seeing the way forward in life. It can push the person toward depression and other more. So any other forms of life stressful event, as I've mentioned, can push somebody into depression. Medication-wide, most of the drugs that people use, side effects can lead the people into depression. And those that they are using hard drugs too, it can also lead them into depression.
I was
So
just about talking about the medication.
yeah.
And you just mentioned.
Oh, I see. So in a nutshell, this is how I can put it on the contributory factors to depression.
I really like everything, but there's one I wanted to stress on, because that one day I think I can say more than 85% of the youth are into it. That's the betting with their money.
Oh, okay.
Because in high school, you see people betting with their fees, even in tertiary and every place. So if you are betting now, they just be careful you don't get depressed. That's
wonderful.
Very
Because
short.
when the money goes astray, trouble for you.
Trouble for you. So you have to be careful out there. All right. So are there any medication to cure it, or just to manage it or something?
Wow. With depression, we don't really cure it. We manage it. Yes. And for public safety, I won't be able to mention specific drugs. But the medication that you use to manage people living with depression are in classes. So you have like antidepressants, and they are a lot. The medications are a lot. So it depends the psychiatrist or whoever that you may meet, the consultant, the prescriber that you meet, per the prescriber's own discretion, will choose the one appropriate for you to be put on, to be managed on. So you have antidepressant that normally you put people, you manage people on. Yeah.
All right. So now that there's a way to manage it, can we prevent depression? Can we?
Yes, we can. Even with the management, it doesn't come to only the medication that you use to manage it. You also have psychotherapy, like individual therapy, family therapy, group therapy. You use that to also support a lot. Yes, you also have complementary medicine therapies. When I say complementary, just supporting, like exercises, yoga, other meditation, visualization. All these are other part of therapies, complementary therapies that you use in supporting managing depression. So when it comes to preventing it, you see, yes, we can. Somebody will say then you need to prevent stress life events first. It's hardly to prevent depression, but you can reduce how people experience the depression. We cannot prevent it totally, but you can reduce it. And how do you reduce it? One, all of us understand in one way or the other, you may meet stressful event. Even it could be relationship-wide. When you meet a situation, what do? You need to use proper problem-solving skills to deal with it, rather than using the improper one. For example, if there's a relationship issue, you and your husband, I think you have heads who are there. I mean, family heads, I mean, the religious heads, and so forth, other stakeholders, to come in to calm the situation, or even take you through certain processes for you to also calm down. So when you are using proper problem solving skills, at the end, it will reduce depression. Yeah. You may also have proper coping skills. Proper coping skills. Yes. You could see that most of the times, 3 people will lose same amount of money at the same time. Some will be just crying uncontrollably. Some would just tell you that, oh, it's okay. After all, even human dies. So no problem. So you see the difference now? Yeah. So you need to use proper defense mechanisms when you meet situations which overweighs it a bit. Yes, and that also will help a lot. We need to share our challenge with people that you are quite, you do quite trust them. Yes, so that we can vent out the heat in us. And as we are sharing with them, at least it also comes as the people also bring certain kind of measures, certain support for that relief to what? To be reached. So I think when you do that, it will help a lot. You in person or somebody experiencing the mild form of depressive symptoms can start exercises, can start yoga, can start meditation, and the meditation needs to be on positive term, not on negative term. For example, your husband is dead and you want to use the meditation method, and you are meditating on how your husband died, how they buried your husband. No, it's not a positive thing that you must use, but rather use at things that like birthday, you are married and so forth, things which are quite positive to do the meditation. You can also use visualization. You meditate on interested places that you visited before and so forth. And all these things will change the mood and make you better. So with this, I think you can reduce the depression. Yes.
So from Mr. Richmond's statement, he didn't mention of using alcohol or drugs. So those out there that uses alcohol as a way to manage their moods, you should be careful out there. And let's say those that take or smoke and all those that, you should all take it out because they are all not good for you. Since he didn't mention it, meaning it's not good for you. And another thing you all have to also note, which I like from what he said, is sharing your stories. Yes, sharing your story, because I think they said sharing is a problem shared is a problem solved. Yeah, I think
it's half solved.
It's half solved.
Yes.
I think it's still working now. At least you bringing it out of yourself can help you calm down a little.
Yeah,
So
you are saying on alcohol as reminded me something.
Okay.
Alcohol, as you know, is a depressant.
Okay.
So it even aggravates depression. So if you are depressed and you are taking alcohol, meaning that you are mounting the problem. So those that they use alcohol to solve their depressed challenge, they are rather worsening the situation. So it's good they stop it. Yes, and I cannot really confirm to 100%, but what I know is that other hard drugs also has the greatest influence on aggravating the depression. Yes.
Thank you very much.
Don't mention.
For enlightening us more.
Don't
All right.
mention.
So we wanted to know. So right now, what actually in depression causes people? At what extent can depression cause someone to harm him or herself?
Oh wow! So the time couldn't permit me to elaborate much on the signs and symptoms, but some of the other signs and symptoms, and we see it to be cardinal, are hopelessness and helplessness. These are one of the these are major symptoms to depression. When the person feels to be hopeless, when the person feels to be helpless, the person will have what is called suicidal thought or suicidal ideations. So these most of the time, and when those people are not getting the enough support earlier, they rather tend to have these suicidal ideations and they end up their life. You see, depression, as you've heard of, are in different levels. You have the mild depression, you have the moderate depression, you have severe depression. So at times, those that they can come to us to tell you that, or to tell us that I have the sad mood, and they may fall under mild or moderate. When you get to the severest form of depression, there the people think twice of killing themselves. Yes. So that's the clinical depression. Yeah.
Thank you very much. Thank you.
Don't mention.
You out there, suicide is so bad. Don't try it. Okay. Whatever you are facing, you are okay not to feel okay. Just share it with someone, and someone is out there to help you. Okay. All right. So, Mr. Richmond, your final words so that we.
Wow. Me being a community mental health officer, the experience I have gotten so far, I've realized it's not easy now for people to afford mental health care, especially when they are being admitted. So I will plead to citizens of Ghana, our viewers, that whoever is experiencing any of the mental illnesses or going through mental challenge or having the symptoms of mental illnesses, they shouldn't wait till the situation become worse. Earlier the better. Now, you have community psychiatric unit at every government hospital in the country. So they've now decentralized the mental health care. So unlike before, that only Pantine, only Accra Mental, only Ankafo, that people were going for mental health care. Now, it's at desktop, at the doorstep of every individual. Wherever you found a government hospital, there's a community psychiatric unit there. Go there, be assessed, and be helped, and you are free. Thank you.
All right, viewers, thank you for being with us from the beginning to the end. As I said, this is Mr. Richmond Bafo, and here is Amasel TV. You see the description box below. We have the contact of Amasel TV there. If you have any question you want us to, let's say, address it for you, you can drop it in the comment section or in the description box. There's our Telegram link, our WhatsApp link. Just take the numbers there and call us or text us. We'll be very ready to address your issue. And even if you want to, let's say, if you have any challenges about, let's say, your mental health or you need some support, you just reach to us. And we'll be very glad to be of help to you. And as I said, the program today is brought to you by Brainward Academy, located in Asamankese. Reach them out for your WASI, BC, NODEC, remedials, and whatever. And we also have the SL Mall and delivery services at home. They are there to deliver your goods at the rightful place it should be. Till we meet again, stay blessed, and always remember your mental health is also important. Thank you.